Morning to all participants. Salam sejahtera buat kita semua. On behalf of ASHRAE Indonesia, we would like to welcome you all to our webinar this morning with the topic of human health and the impacts of the building and HVAC system. I'm Ferdian. I will hosting this webinar, and we are so glad and honored to have our moderator today, Dr. Ririn, and also two very special and important speakers that will be presented their topic that is related to the human health and the impacts of building and HVAC system. But before that, I would like to invite Mr. Fatur Rahman as Indonesia chapter president to give opening remarks. Pak Fatur, the stage is yours.
Thank you, Pak Ferdian. Wait a moment. I share my screen. Okay, Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone. Good morning, ladies and gentlemen. Thank you for coming and joining with us in this webinar series from ASHRAE Indonesia chapters. And as Pak Ferdian said, that this is a special program because this time our webinar series is junction with our distinguished lecturer program. So this is an honor for us to having Dr. Stephanie Taylor today. Dr. Stephanie, how are you? I hope you are in health and fine. Thank you very much for your time, because we know that in Vermont, US, this is not your office hour, but you already spend time for us to present your interesting presentation today. So I believe everybody here is waiting for your interesting presentation. According to our topic, the human health and the impact of the building, according to HVAC system. And also I would like to say thank to our sponsor from AAF. There is also speakers, Mr. Raymond Wong from Malaysia. Selamat pagi, good morning, Pak Raymond.
Good morning.
I hope you also in fine and healthy condition today.
Yeah.
And we have also moderator Dr. Ririn. Thank you, Bu Dokter. You have spent your time to moderate this interesting topic, because I believe everyone here is concerned about the human health in this COVID-19 situation. So everyone will be talking about the health and according to the air conditioning system. And from my side, I would like to have some slide for opening remarks, because this is also our responsibility to share our ASHRAE information. So apologize to Dr. Stephanie and Raymond. Maybe I will take this presentation in Bahasa Indonesia. And thank you for joining with us once again. So Bapak-Bapak Ibu sekalian, selamat pagi. Terima kasih sudah hadir pada kesempatan hari ini. Jadi untuk sebagai pembukaan, saya akan menyampaikan beberapa poin perihal dengan ASHRAE. Pertama, terkait dengan polisi yang ASHRAE keluarkan di setiap acara ASHRAE, di setiap acara resmi ASHRAE dan webinar ataupun meeting, kita selalu membacakan kode of etik yang kita miliki. Jadi we will act with honesty, fairness, courtesy, competence, and inclusiveness, and respect for others, because we have our core value of excellence, commitment, integrity, collaboration, volunteerism, and diversity, and we should avoid all real or perceived conflict of interest. Dan di ASHRAE juga punya commercial policy dan juga edukasi dan juga peraturan tentang sexual harassment, di mana kita sangat concern terhadap hal ini, sehingga dalam penyelenggaraannya ASHRAE selalu mengedepankan policy yang ASHRAE miliki. Ketahui bahwa ASHRAE adalah organisasi yang sudah cukup lama berdiri, lebih dari 1 abad yang lalu, dimulai pada tahun 1894, hingga saat ini memiliki 57.000 member di seluruh dunia, tersebar di kurang lebih 130 negara di seluruh belahan dunia, dan kita salah satu negara yang memiliki chapter. Jadi chapter ini adalah subbagian dari ASHRAE Society yang berada di US. Sekarang kita juga sudah memiliki begitu banyak student member, dan kita mengharapkan jika partisipan di sini ada yang member student, kita mengharapkan Bapak Ibu sekalian bisa join, karena dengan student member kita ada meninggalkan estafet keilmuan kita di refrigerasi dan air conditioning. Kemudian klasifikasi yang orang-orang siapa saja yang bisa join di ASHRAE tentunya tidak terbatas di mechanical engineer. Sekarang sudah meluas hingga ke manufacturing, kemudian juga government, kemudian the health and education, design and build, bahkan arsitektur. Sehingga kami berharap mengencourage Bapak Ibu sekalian untuk join. Bapak bisa buka halaman websitenya di ashrae.org/join. Di situ akan ada informasi bagaimana Bapak bisa bergabung, Bapak Ibu sekalian. Kemudian Bapak tinggal masukkan data-data pribadi Bapak, data bisnis dan profesional Bapak. Dan pada final step, kita harus membayar sejumlah fee untuk tahunannya. Dan jangan lupa di Indonesia merupakan salah satu negara berkembang yang disupport oleh ASHRAE, sehingga memiliki rate khusus untuk menjadi membership. Untuk informasi bahwa sekarang membership adalah $135, kemudian untuk student member ini hanya $15 saja untuk Indonesia. Apabila Bapak Ibu sekalian memiliki kesulitan dalam melakukan proses ini secara online, mungkin kartu kredit dan lain-lain, kita juga siap mensupport Bapak untuk melakukan registrasi atau membantu Bapak untuk pendaftaran. Silakan kontak kita dan kita akan senang sekali membantu Bapak Ibu sekalian untuk mendaftarkan dan kita lakukan transaksi. Kemudian tentunya dengan menjadi membership ASHRAE kita akan mendapat banyak benefit yang saya yakin bisa bermanfaat untuk Bapak Ibu sekalian. Jadi dimulai dari tahun lalu bahwa setiap member baru, kemudian setiap tahunnya juga akan mendapatkan free dari pilihan 3 dokumen. Pertama adalah Bapak Ibu bisa mengikuti e-learning course 1 topik, atau Bapak Ibu memilih untuk memiliki ASHRAE standar, atau juga Bapak Ibu memilih untuk memiliki ASHRAE handbook. Nah, jadi dari ketiganya bisa kita miliki, dipilih salah satu. Kemudian juga dengan networking ASHRAE yang secara internasional, kita akan memiliki jaringan yang luas secara global, tentunya akan memberikan manfaat dan juga akan memberikan perkembangan kepada Bapak Ibu sekalian. Kemudian di professional development, ASHRAE begitu banyak resources untuk kita mengembangkan diri kita khusus di bidang air conditioning dan refrigeration. Di antaranya adalah program e-learning, kemudian juga ada ASHRAE Learning Institute. Di situ ada course dari mulai level dasar, kemudian level berikutnya dan level advance. Dan untuk para engineer yang sudah qualified atau sudah PD dengan kemampuannya, ASHRAE juga memiliki program sertifikasi, yang mana sertifikasi ini sangat banyak topiknya, tergantung dari ketertarikan kita. Seperti contoh, sekarang banyak sekali orang yang berminat untuk melakukan energy modeling, karena kita tahu energi merupakan satu hal yang challenging ke depan. Kemudian juga healthcare facility design, lalu ada HVAC designer, berikutnya ada commissioning dan lain-lain. Tentunya ini membuat pengakuan sebagai seorang engineer akan lebih lengkap ketika kita memiliki sertifikasi yang diakui secara internasional. Berikutnya adalah ASHRAE support, di mana setiap fee member itu kita gunakan ada namanya divisi research and promotion, di mana ini akan mengalokasikan dana yang terkumpul. Dan walaupun di pasca pandemi yang sulit tahun lalu, kita bisa mengkolek 2 juta, hampir 2 juta dolar lebih, di mana sebagian besar dana tersebut digunakan untuk research. Kemudian sebagian lagi untuk foundation dan beasiswa, scholarship, dan kemudian untuk kegiatan lain seperti general fund, young engineer, dan juga edukasi. Terima kasih untuk supportnya. Kemudian seperti yang kita ketahui juga banyak sekali standar yang ASHRAE keluarkan dan sangat familiar dengan kita, terutama di building. Seperti contoh misalnya ASHRAE standar 55, di mana membahas thermal environmental condition for human occupation, kemudian juga ada 62 membahas tentang ventilasi, dan standar-standar lain yang memang sangat erat terkait dengan dunia kerja kita. Lalu seperti kita tahu bahwa ASHRAE Handbook ada empat volume, yang dimana secara pendidikan juga kita sering melakukan atau membedah ASHRAE Handbook ini untuk menjadi bahan pengajaran gitu. Kemudian ada 4 volume, di mana ada fundamental, ada application, ada system and equipment, dan ada juga refrigeration. Dan refrigeration ini juga satu hal yang menarik, karena kita tahu di masa pandemi bahwa banyak cold chain, banyak vaksin yang didistribusikan. Ini merupakan salah satu potensi di mana refrigeration akan sangat berkembang ke depan. Kemudian jika kita setelah menjadi member, maka kita akan mendapatkan ASHRAE Journal yang akan dikirimkan tiap bulan, di mana di sini akan ada update-update teknologi, informasi yang terkini terkait dengan sistem ataupun terkait dengan komponen dan lain-lain, di mana akan dikirimkan secara otomatis ke email Bapak Ibu sekalian berupa link online. Kemudian juga ada di building, ada High Performance Building Magazine, juga Bapak bisa dapatkan di sini. Tentunya sangat menarik bagaimana kita topik mencapai net zero energy misalnya, atau juga membuat performance building yang lebih baik. Kemudian ada Advanced Energy Design, ASHRAE secara free memberikan guideline, handbook untuk merancang sebuah bangunan yang hemat energi, baik di skala kecil, small, medium, office building, dan lain-lain. Nah, ini refrigeration, ASHRAE juga mengeluarkan beberapa guideline, beberapa manual untuk refrigeration facility, untuk cooling, refrigeration, chilling, freezing, dan juga cold chain. Nah, ini slide terakhir dari saya, bahwa semenjak COVID-19 menyerang kita di 2020, ASHRAE telah membentuk Epidemic Task Force, di mana di sini merupakan sekumpulan orang-orang yang luar biasa yang mencoba mendedikasikan keilmuannya untuk membuat sebuah standar, dokumen standing, dan lain-lain. Dan Bapak Ibu sekalian bisa mendapatkannya dengan mengakses di ashrae.org/COVID-19. And Dr. Stephanie Taylor is one of the member of Epidemic Task Force. So we are very glad and very honored to have her today, this morning. And without further ado, I will finish my presentation. And once again, thank you very much for coming, Dr. Stephanie. And hope have a very interesting discussion and presentation, and happy webinar. Thank you very much. I go back to Pak Ferdian. Thank you, Pak.
Thank you, Pak Fatur, ASHRAE Indonesia Chapter President, for the very encouraging and interesting speech and remark. And once again, we would like to invite all of you to join with ASHRAE Indonesia Chapter, and we can gain a lot of benefits and networks in the organizations. Okay, before we move on to our main topic discussions, we would like to announce two important notes to all of us. First, this webinar, we will provide e-certificate to all participants. So in a few moments, our digital team will share a attendance list in the chat box. So everybody who want to have a certificate, you may fill the attendance list in the link in the chat in a few moments. And also, we would like to encourage all of you to also fill our evaluation form. That can be a very good input and suggestions for us, so we can improve and we can make a more interesting webinar in the near future. So in a few moments, our digital team will share 2 links that we all can actively fill and also give so many inputs to our webinar series. Thank you. So next, we would like to invite our moderator, Dr. Chayarini. So Dr. Chayarini is co-chair of Governor Affairs, ASHRAE Indonesia chapter, but also she have a very long experience and career in Royal Taruma Jakarta Hospital and also Persahabatan Jakarta Hospital, start from 2008 until now. And also she is a chair of committee PPIS, Bidang Pengembangan Profesi dan Pelayanan Kesehatan PAMKI Pusat. So Dr. Chayarini will be the moderator to our discussion today. I would like to invite and give the stage to Dr. Chayarini. Dr. Chayarini, the stage is yours.
Thank you, Pak Ferdinand, for introducing me. Assalamualaikum warahmatullahi wabarakatuh semuanya. Good morning, everybody. Nice to meet you all in ASHRAE Indonesia chapter webinar series. This webinar will be held in 2 sessions. Each session has a presentation and discussion. You can ask anything to the speaker in the discussion session. We type your question in Q&A box. Now, let's begin session 1. First, I will introduce our distinguished speaker from Vermont, USA, Dr. Stephanie Taylor, Magister Architecture. She is from Harvard Medical School, and right now, as an ASHRAE Distinguished Lecturer Epidemic Task Force Environmental Health Committee, and President, also a founder of Building for Health. Dr. Stephanie will present about human health and the impact of buildings and HVAC system. So, Dr. Stephanie, your presentation will last for 50 minutes. Now, time is yours. I invite you to present.
Well, thank you so much. I'm absolutely honored to be here tonight. And it is my first time ever speaking to your chapter. So thank you again for inviting me. And like Dr. Rini, she's given me permission to shorten her name a little bit. I am passionate about the relationship between the indoor environment and human health. So as a physician, I came a little bit later in the game to understand or to try to understand buildings and indoor air quality and how indoor air quality relates to human diseases. So this is me when I'm seeing patients. My primary clinical specialty is pediatric oncology, which I do some parts of the year, and the rest of the time I'm working with ASHRAE and around this intersection of human health and the built environment. So in the next 45, 50 minutes or so, I would like to go through these 4 areas or 3 areas and then have time for questions, disagreements, agreements, and any discussion that you want to bring forth. So to start with, I'd like to talk with you about how I, as a physician, became very convinced that the indoor environment was a very powerful tool in promoting human health. And then I would like to talk with you about how we can really begin to understand, using medical data, in conjunction with building data, how we can really understand how to manage our buildings to promote human health. And then I would like to share with you some work that I've been doing recently around creating a human health standard for indoor air quality. So to get started, this first part will just be my own personal story about how I began to transition from just practicing clinical medicine to also understanding buildings. So believe it or not, this is me, not yesterday, but when I was in my 20s. And I was at Harvard Medical School, and I decided that I wanted to have an adventure. So I looked at the map and thought I've always wanted to go to Papua New Guinea. So I went to Papua New Guinea for 4 months. And during that time, I was lucky enough to get a position working at the HVAC General Hospital in HVAC, Papua New Guinea. And you can see I had a great time. It was just absolutely fascinating. And the hospital that I was stationed in, the HVAC General Hospital, had fairly, what seemed to me as a medical student from Boston, Massachusetts, it seemed quite rustic or different from what I was used to. The family members would stay in the beds and help take care of the patients. This was in 1985. In the middle, you see the men's tuberculosis ward. The beds were fairly close together. You could see there was good ventilation. However, it didn't look that hygienic to me. And on the right, that's a patient we were getting ready to do surgery on. And you can see me standing there with what we call flip-flops, so sandals on my feet, which is what everyone wore. So when I looked at these physical environmental conditions, I thought, this doesn't look as clean as what I was used to. And yet these patients did very well. They went home when we thought they would. They didn't get new infections. So when I went back to the United States and was working in the Massachusetts General Hospital in Boston, I became startled by how many patients got sick and too many died from these nosocomial infections, or as we call them, healthcare associated infections. The gentleman on the left had a knee injury. He went in to have a 1-day outpatient procedure, and he came back 4 months later without his whole leg and almost without his life from a staph infection. The little girl on the right is one of my oncology patients who survived her cancer and almost died from an infection. And yet these hospitals look clean. So as a physician, I began to ask my other physician colleagues about the role of the building. And they didn't think it was that important. They didn't understand buildings. And frankly, neither did I. So my concern about the building and yet my lack of knowledge is what led me in my 40s to go back to school, get my master's in architecture, and learn how to design hospitals and how to understand HVAC systems. So from there, I would like to go back even further in time from when I was in medical school and just take a broad look at the intersection of human shelters and diseases. Because a long time ago, we used to, as human beings, we lived in shelters where we had lots of communication with outdoor air, soil, water. And then as our building technology and our building materials became more sophisticated, we gradually moved indoors. We developed sanitation systems. And really by the Industrial Revolution, most of us were living indoors unless our work was in agriculture. And then fast forward to 2021, many offices are in high-rise buildings that were warm, dry, very comfortable. At least in the US, many buildings have non-operable windows. So we've really tightened up our buildings as time has gone by, especially since the 1970s energy crisis, where we began to focus heavily on energy conservation, which is important. But interestingly, despite our more sophisticated sanitation systems, we've also begun to see a rise in certain categories of diseases. So infectious diseases of some types are one of the kinds of diseases that we're seeing an interesting increase in certain bacterial or viral diseases. We're seeing an increase in allergic disorders. We're seeing an increase in inflammatory-based illnesses, from inflammatory bowel disease to even to heart disease, which we now know is related to inflammation. So we're seeing a rise in certain diseases. One of my colleagues said, we shape our buildings, then they kill us. So this is kind of depressing, but don't worry. This isn't a talk about being depressed, because what we're now learning is that buildings are actually probably one of the most important tools that we have for keeping us healthy. So here we are in 2021, battling this COVID-19 pandemic. I don't know about you, but I am tired of it. It still worries me, but I've just had enough. I think I'm not alone in that feeling. But if we look through history, like even just back to the Spanish influenza, but there have been other epidemics and pandemics since then and before that. And one of the things that these pandemics, at least respiratory viral pandemics, one of the things they have in common is that they're caused by viruses that have a significant airborne transmission, and they're caused by viruses that can mutate or change quite easily and adapt to new environments. So if that virus finds a host without an immunological defense mechanism, such as a human being that hasn't seen that exact virus before, that's when we have a pandemic. So the point of my talking about this is that when we think about managing our buildings and when we think about managing indoor air quality to prevent disease and to support our health, I want all of us to think not only about what levels of particles and CO2 and different indoor components are. I want us also to think about the effect of that indoor air quality on the human immune system. So it's both the building and the human being that are being affected. And again, I promise you, this isn't all going to be negative, but I do want to point out that even after this pandemic is either managing it or we're beyond it, there are other pathogenic or disease-causing viruses and bacteria that are out there in the world. And there are new ones that are constantly evolving that we need to think about. This map is from 2017 from the Center of Disease Control. And you can see in red the viruses or the bacteria, disease-causing ones called pathogens that are emerging. And you can see in your region, there are a number that are somewhat nearby. But my point of this slide is just to say, even after this pandemic is over, we need to consider infectious disease transmission indoors. And furthermore, the indoor environment, it doesn't only affect infectious disease transmission. We now know from numerous studies that lots of human health components are affected by indoor air quality. How tired you get at 2 o'clock in the afternoon. Maybe you're like me and you find yourself drinking coffee and trying to revive your energy level. Well, some of that fatigue is due to poor indoor air quality. It makes us less productive. We might feel stressed. Indoor air quality can promote or suppress allergies, skin disorders, autoimmune diseases, and of course, different respiratory disorders. So the indoor air is incredibly powerful as something that either promotes health or promotes disease. And if you think about it, we have a tremendously intimate and powerful relationship with indoor air. I mean, I live in beautiful northern Vermont in the United States. There are mountains all around me. I like to snow ski. I like to play tennis, bicycle, but I'm still indoors more than I'm outdoors. each of us breathes about 11,000 liters of air into our lungs every single day. I mean, that's a huge amount of air. It takes about 54 minutes for chemicals in the air that land on our skin. It takes about less than an hour for some of those to penetrate our skin and get into our blood. So our skin is not an impermeable barrier to chemicals in the air. Those chemicals do get into our body and can have an effect. And our thinking, our anxiety levels, our mental health are very much affected by what's in the air. So how do we know exactly what we should be watching for in terms of indoor air quality? How do we know which components are the most impactful for our health? So how do we begin to untangle this relationship between medicine and building sciences? Because, if I think about the profession and including my own journey, building standards are kind of in one professional and educational silo where we think about energy conservation. We hope our buildings will protect us from very obvious disasters, fires, earthquakes, floods. But how do you know that what we're monitoring and controlling for in terms of those disasters, how do we know if that building is really protecting our health? So if this is your family member or yourself, how do we know if those particles in the air and the gases surrounding this young woman, how do we know if we're managing our buildings for her health? Because if you think about it, our language in building metrics, we talk about indoor air quality. Now that people are struggling with indoor viral transmission, we talk about indoor air quality viral counts. We talk about the Wells-Riley equation. We measure particles, volatile organic compounds such as formaldehyde. We talk about humidity, and all of the things you see listed on the left. However, in medicine, as Dr. Rini knows so well, our language and our abbreviations are very different. When we look at infections, we look at white blood cell counts. We talk about all sorts of medical measurements. But these things are very different. And yet we need to come together and work together, both building professionals and medical professionals. So before we go any further, I want to show you this very brief video that gives you a look at our indoor environment from a much more microscopic perspective. And this video that I'm going to show you is based on not just tissue cell or looking through a microscope at cells, but it's based on looking at RNA and DNA fingerprints of all of the microbes that are in our buildings, in our body, and on our bodies. So you might have heard of the microbiome of your intestines, all of the communities of microbes that live in your body. So this video is going to show you how all of the microbes that relate to our body enter into our indoor environment. So as I'm talking and you're all breathing, little droplets come out of our airways about 100 microns in diameter. Those droplets carry particles, normal bacteria and viruses. You can see as this engineer works away on her drawing, particles are coming from her body, from her hand. Those particles and all of the associated bacteria and viruses are landing on her paper, on the desk. You can see particles coming out of her nose. Those are not liquid droplets. Those are just breathing, normal dry particles. You can see her digestive system is illuminated. We have lots of particles and bacteria in our colon and small intestines. And you can also see that surfaces and particles and microbes on surfaces also enter the air. I mean, we live in a three-dimensional world, so not surprisingly, surfaces and air communicate. And then again, depending on how tightly sealed your buildings are, you're going to have more or less communication. So the point of that video is not to make you frightened about microbes. The point of that video is to show you how we have a very active exchange between human beings, bacteria, viruses, particles, and our environment. So how do we manage our indoor air so that we only select for the good bacteria? 95% of bacteria and viruses are actually good for us. We couldn't live without them. But 5% of those microbes cause disease. So we want to be able to have the good ones around us, but not the ones that cause disease. And interestingly, I think this slide is one of the most important slides of my whole presentation. And what this is depicting is research that shows that, number one, each of us sheds about 37 million microbes into the air per hour. I mean, that's a lot of microbes, but don't forget, most of those are good for us. But as we send our microbes into a building, we also know from research, and I'll give you this presentation and all of the references, but depending on how your building is designed, used, and ventilated, certain of those microbes are selected to survive. And certain of those microbes will die if they can't survive your indoor conditions. But if you think about this, what it really means is that the indoor environment, and specifically indoor air management, is one of the most powerful evolutionary forces that we encounter, because all of these microbes will live or die based on our indoor air quality. And the ones that live further affect our health. So our understanding of microbes indoors through genetic analysis research, which is fairly recent, the last decade, we're now getting a better idea about how powerful the indoor environment is. So what have we learned from looking at metagenomic analysis or genetic analysis of our buildings? Well, first, we've learned that our attitude that all bacteria or viruses are germs, they all make us sick, they're all bad, that's incorrect. We now know that only a small percentage of microbes are bad for us. But what we want to be careful of is we don't want to wipe out all of the good ones so that the very hardy, the microbes that survive can take over. Because again, don't forget, most microbes are good for us. So we want to select for the ones that are good for us, not the ones that cause COVID-19 or measles or tuberculosis. And so when we think about surface hygiene, again, we want to move beyond this concept of total sterilization of our surfaces, which is, number one, impossible, and number two, again, allows the more powerful ones to replicate. Now, of course, if you're in a hospital, if you've had surgery, or if you have third-degree burns on your body, or if your immune system is compromised, you don't want to be thinking about good bacteria versus bad. You just want them all to be gone as much as possible. And that's true. When you're very vulnerable, you want to have as few microbes around as possible. But as we live our daily lives, remember, a lot of microbes are good for you. And in fact, for those of you who have dogs or live with animals, animals actually have very healthy microbiomes or microbial communities. So children who grow up around animals actually have fewer infections and fewer allergies that children, compared to children who live in a very sort of sterile environment. I happen to have 8 dogs, so I'm a little bit biased, but it's also true. So let's go back to the question, how do we understand which indoor components are truly associated with infections? So this study that I'm just going to talk about briefly was done in a hospital. And a hospital is a great place to study the intersection of the indoor environment and human health. And the reason I say that is not just because I'm a doctor and I spend a lot of time in hospitals, but to do this kind of study, you need to collect data on the human occupant and you need to collect data on the environment. And at some point in my career moving into architecture, I realized that patient outcomes or patient infections is another metric for the building. So in this study, we looked at patient rooms in a brand new hospital, and we monitored all of the things you see listed in the middle. So every 5 to 30 minutes, we measure temperature, hand hygiene compliance, room pressurization, lighting, CO2, humidity, room traffic, room air changes, outdoor air. The filtration remained constant. So we had about 8 million data points from the environment, from the patient room environment. And we correlated those data points with patient infections, new patient infections, nosocomial infections. So I want you to think to yourself, which of these do you think might have been related to infections? I thought it would probably be hand hygiene or maybe room traffic. So after 13 months of doing this study, we had lots of data. We sent it off to our statistician, who came back and told us that the most powerful indoor driver of infections was actually low or high indoor humidity. And I was completely startled by this. And actually, I didn't even believe it. I thought it was a mistake. We reanalyzed the data, and sure enough, we found that if you look at this graph, on the x-axis along the bottom is relative humidity indoors. And you can see with the orange and the blue line, so those are respiratory and gastrointestinal infections, that there's a very sharp fall in infections as the indoor humidity came up to 40% and a little bit higher. So 40 to 60%, we saw the fewest of infections in some categories. The green line, the green dotted line, happens to be urinary tract infections or bladder infections. And those infections were related to other things such as patient mobility or whether or not a person had fecal or urinary incontinence. But the other infectious types were higher when the relative humidity indoors was low or over 60%. So in the United States, in the wintertime, we bring in cold outdoor air with whatever absolute humidity there is. We warm it up, and unless you add humidity, the relative humidity in the wintertime in the heating season can be very low. And also in the US, and I understand you're in a different climate. I tried to look into that before this webinar to see what your design parameters were. And I know that high humidity is a factor in some of your buildings. So I think this zone, this very protective zone of 40 to 60% relative humidity is still an important factor across the world, because you don't want to be above 60% a lot of the time, and you don't want to be below 40% indoors. So this is another study, again, about indoor humidity and influenza. This is influenza A transmission. And in this study, a group at the Mayo Clinic in Rochester, Minnesota, took a preschool and humidified half of the preschool in the wintertime and kept it around 45% relative humidity, and let the other half of the school humidity do what it does in the wintertime, which is to fall quite low. So you can see in this table, the part of the school that was humidified to 45% had some very interesting differences compared to the rest of the school. For one thing, if you look in this column, the second column from the left, in the humidified part of the school, there were many fewer airborne particles carrying influenza A virus. And this was as determined by the genetic analysis test, PCR. Interestingly and surprisingly, the actual infectivity of those viruses in the humidified part of the school was less, 35% compared to 75% infectivity. So there were fewer particles in the humidified part of the schools, and the ones that were present were less infectious. And then, not surprisingly, you had many fewer children miss school because of influenza than in the humidified classrooms versus the non-humidified. This study was replicated in 4 other schools, the same results. So once again, this 40 to 60% humidity zone was protective to the children. So you might be wondering, well, hopefully I'm not speaking too quickly. I hope my message is understandable. But what might be happening? I think what's especially interesting and surprising to me is this third category, third column. Why is it that when the humidity is in this 40 to 60% range, the viruses are less infectious, they're less bad? So in this study, which shows data from Lindsay Marr and Lydia Moralski and others, is looking at the droplets that come out of our mouths and our airways as we breathe into indoor environments with different levels of relative humidity. So here on the left, as I'm talking and you're all breathing, if I had influenza or COVID-19, the droplets coming out of my mouth could very well carry that virus. So you can sort of see the virus is in the droplet. Also in this droplet are salts, proteins, and carbohydrates that are in our mouths, our noses, our sinuses. But if your indoor air is between 40 and 60%, research is showing that the microbes, the viruses and the bacteria that are in those droplets are actually, so they're surrounded by salts and proteins. And when the indoor relative humidity is in this mid-range zone, that droplet shrinks to a point where the microbes that are within it are actually inactivated. The salt concentration rises, the protein concentration increases, and in the middle here, you actually inactivate many microbes. However, if your indoor relative humidity is less than 40%, that droplet shrinks down so fast that the salt concentration goes up, and you're actually preserving the viruses and the bacteria that are within that droplet. They may be temporarily dormant or inactive, but once this droplet lands in somebody else's airway or on their skin, it rehydrates, and the microbes within this droplet are still highly infectious. So we think that it's this inactivation that occurs in mid-zone humidity that is responsible for the decreased infectivity. So here's a third aspect of why mid-range humidity is important for our health. So this study, I'll just show you this paper, and you can look it up and read the study in detail. But Dr. Iwasaki at Yale found in 2019 that our immune system is actually harmed, is impaired by low relative humidity. She found that not only was the mucus in our airways was too thick, but there were other components of our immune system that were actually harmed by dry air. So let's talk a little bit about not just about individual buildings or not about research in the lab, but I want to share with you now a study that I participated in or helped do with some of my colleagues at the Massachusetts Institute of Technology in Boston. So when COVID-19 first started, you might remember that the outbreaks were along certain lines of latitude globally. So this was in the beginning of the pandemic. This was March 2020. And you can see sort of generally, the big circles being more cases, that there were certain latitudes that seemed to be affected early on more heavily than other latitudes. So I was wondering why this was the case. So I talked to the Department of Statistics at MIT, and we gathered all of the data from around the world in these 3 general areas, trying to understand why there might be regional outbreaks of COVID-19. So the 3 areas that we looked at were government policies and public health measures. That was 1. demographics, testing capability, and socioeconomics. That was category 2. And then thirdly, we looked at ambient, outdoor, and towards the end of the study, we monitored indoor conditions. So we wanted to know, why were we seeing these regional outbreaks? So we sent a massive amount of data off to the statisticians, and they were determined to show us that the grouping or the clustering of cases had nothing to do with the environmental parameters. The students were convinced that it had to do with testing, or it had to do with the age or the comorbidities of people. So they tested and tested and tested the data. Every known test that I had ever heard of, and then some, were used. And at the end of about 4 months of this study, they came back to us and said, we were wrong. The most powerful correlation, looking at all those different variables with both new cases and daily new deaths from COVID-19, was indoor relative humidity. And you can see the graphs here. There are multiple lines. You can see 4 lines here because we are looking at different time offsets, time between a change in the indoor conditions and the number of cases and new deaths. But you can see very clearly that when you're within this generally 40 to 65% relative humidity, around the world, Northern Hemisphere, Southern Hemisphere, and tropical countries, that you had the lowest number of COVID-19 new cases and deaths. So this is really remarkable, I think. So let's move away for a second from infectious disease, and let's just talk about water vapor that's in our air. And you might be thinking that because you have actually very good humidity in your country, probably you wish it were lower sometimes, that you don't have to think about this. And you're true. It's true. You're lucky. You live in a part of the world where you have great humidity. You may not consider it great, but at least it's not too low. Because low indoor humidity, it affects your brain, which affects your energy level, your hand-eye coordination, your memory, your anxiety levels. This shows that this is a 25-year-old man who was in low humidity environment, and he was only 1.5% dehydrated, which really isn't that much. In the wintertime, I'm probably 1.5% dehydrated by 3 o'clock in the afternoon, unless I've been drinking water all day. But you can see that your brain volume actually decreases. The activity within your brain decreases. So this shows the chemical neurosynaptic activity in your brain. But interestingly, this is also what you see in people who are struggling with depression, who take medication to bring up their serotonin levels and other chemicals. So you can see that low humidity indoors has a big effect on your thinking, on your fatigue level, as compared to the same man over here on the right, who is fully hydrated. Thankfully, this relationship between dehydration and brain activity is reversible. And this is another study showing that the red shows your brain. This is your brain. The red shows the thinning of your cerebral cortex when you're a little bit dehydrated, but it also shows how it returns to normal when you're rehydrated. So it's not a permanent change, but it is a very powerful one. Okay, so let's talk a little bit about things other than relative humidity, because clearly humidity is not the only factor that we need to consider in buildings. So as a member of the ASHRAE Epidemic Task Force, we're struggling with how do you know how much outdoor air you should be bringing into your buildings, especially if the outdoor conditions are not comfortable. If it's too hot or too cold, you're going to spend a lot of energy making that air comfortable. So how do you manage the whole picture? How do you manage carbon dioxide, humidity, temperature, particles in a way that's energy efficient? So this is where I'm focusing my work most of the time now, is understanding from the human health perspective how to manage all of these components in a building. So we've gone from thinking about healthy buildings, so we're talking about energy, air, water, light. Then we've zoned in on indoor air quality, and many people measure particles, CO2, all sorts of metrics. And what I'm doing now is looking at indoor air quality through the perspective of human health. And I'll show you how I'm doing that. So I look at not only the individual things such as particles or humidity or temperature, but I'm also looking at how indoor pollutants or indoor compounds interact with each other. So what interactive chemistry is going on that results in compounds or conditions that also affect our health. So for example, pollutants such as nitrous dioxide, sulfur dioxide, particles, carbon monoxide, ozone, these things interact with each other. And the interacting compounds sometimes have a more powerful effect on our bodies than the individual levels. So again, how do we know where we should be focusing our energy? And this slide just shows you, and we don't have to go through it in detail, but again, so this shows a cell membrane. So this is a membrane that lines each of your cells. This is the outside and the inside. And for a particle or a molecule to get into your cell, it has to pass through this complicated 2-layer membrane to get inside your cell. But depending on what the gas is, whether it's carbon dioxide, ozone, how charged it is, how large molecules are, things are going to get into your body more or less easily. And when particles or gases penetrate your body, if they're not good for you, they affect your cardiovascular health, as we've already talked about. They affect your productivity and your cognitive health, and your surface membranes like your eyes, your skin. So how do we know what to do? How do we know at a large scale level what to do? Well, if you lived in West Virginia or Kentucky, and if you were in the coal mining business, you would know that this slide shows that coal miners used to release these beautiful little canaries into the coal mines to see if the air in the mine would support the life of the bird. So canaries have a high oxygen demand. So the miners believed, and I think they're right, although it's terrible for the bird, if the bird came out alive, that the air was okay to breathe. But we can't really assess our indoor air in buildings by releasing flocks of canaries. At least, you can't go into a restaurant and release birds without being thrown out. So what can we do to monitor the air? So what I've been doing now, and what I want to tell you about, is this approach that I'm taking now, where I monitor 9 different components that we know affect human health. So thermal metrics, temperature, humidity, particle counts and densities, different size particles, volatile organic compounds that are released from materials and have other sources, and relevant gases indoors. So carbon monoxide, carbon dioxide, the things you see listed. So we monitor all of those things continuously and analyze them from the perspective of human health, using medical literature and medical studies to understand how these components affect the human body. And then we come out with a score that says, if you're at 100, your building's in great shape, it's supporting human health. And if you're below 50, you need to fix something. So this is a way we're able to take a look at the indoor environment, again, through the lens of human health. So was really interesting. I put one of our monitors that measures these 9 things into my office where I am right now. And you can see it came back kind of not that great. I mean, 57 is not terrible, but I would rather have it been at 100. But it came, and my colleagues were like, they're like, Steph, what's going on in your office? It's not, the indoor air is not very good, even though I live out in the country. And I looked at it over time, and sure enough, my health rating was kind of bad most of the time. And I thought about this, and when I looked at the timing of the charts, I realized that around 4 o'clock in the afternoon, my health rating was pretty bad. And it was also around that same time I would get a headache. I was exhausted. I'd drink coffee. I'd exercise on my bike, trying to increase my energy level. But when I looked more deeply into this, I learned that my office is in through the wall of my office is a ski binding manufacturing business. And around 4 o'clock in the afternoon, they were coming in, they were starting up their glue guns, VOCs were pouring into my office, particles, carbon dioxide. And even though I couldn't smell these things, my indoor air quality was kind of terrible around 4 in the afternoon. So this was really fascinating because when I asked my landlord to put in different exhaust vent ducts and to exhaust the air from the manufacturing part somewhere else in my office, my indoor air quality improved dramatically. And this just sort of shows you some of the things we look at when we look at the interaction of particles, VOCs, and gases to understand how to remediate. But furthermore, this was really surprising to me. We also learned that once again, when the relative humidity was in a good zone, the health impact of these other pollutants was not as bad. So this graph shows, if I can move me out of the way, that when the relative humidity indoors was between 40 and 60, the health impact of these other pollutants was not as bad. So in this graph, 100 is good. Just think about your score in school. 100 is good, 0 is terrible. So the nitrous dioxide or sulfur dioxide, which often comes from outdoor pollution from combustion, some indoor sources, the existing NO2 and SO2 was less harmful to the human immune system and human cells when the relative humidity was between 40 and 60. Same with particles. Humidity really impacts particles. Low humidity results in higher airborne particles. So again, this graph is showing that for all of these indoor pollutants, indoor water vapor levels is very important. How am I doing time-wise? A few more minutes. So then now moving back to ASHRAE, we talk about outdoor air ventilation, we talk about filtration. The recommendation with COVID-19 is MERV 13. We talk about pressurization and directional airflow. But most of these strategies are related to the indoor humidity. So again, at least in the US, where you have these clear seasonal trends with indoor humidity, it's really important to try to maintain this mid-range. And the same in your region. You want to keep it under 60% to support your health. Again, we address through LEED and through just knowing that we want to decrease outdoor air pollution and energy and carbon fuel consumption, that we don't want to use high energy solutions in our buildings if we can avoid them. So is this really a tug of war that we're engaged in, where it's either energy or occupant health? And in some situations there is, you're on opposite sides of the fence, but not always. For those of you who read the ASHRAE journal, this was an article that I wrote about a year ago talking about improving indoor environmental quality to reduce transmission of airborne pathogens in cold climates in an energy efficient way. So I encourage you to take a look at this issue if you're interested. But in general, how do we get people to listen to us? How do engineers get building owners, architects, designers to listen around the proper solutions? And it always comes back to money. Because if you're in a space where, if your value is very clear, if you're a research animal and if your death is going to cause, is going to be expensive because you're going to mess up the study, or if you're an astronaut in space and a lot of money's gone into your training, or if you happen to be a famous painting or a piano or a book, you're going to be in a great indoor air quality. I don't know how many of you on this webinar have ever designed research facilities or any of these types of buildings, but there's a huge focus on indoor air quality to support the well-being of these occupants. But what about those of us who aren't a famous painting or a book or a piano? What about managing buildings for the average person's health? So I just want to take a little aside. This is me with my son, Colin, who's an emergency room physician, and we were hiking in Peru shortly before the pandemic. This young man is my pride and joy. I've been nicknamed Mom in this webinar. But Colin and I were hiking in Peru, and you could see we were kind of in the middle of nowhere. This was like a good trail. And we came upon this little stone mausoleum that had the important villagers who had passed away inside. And you can see, I hope this isn't upsetting to anyone, but you can see these people had passed away and they'd been wrapped in cheesecloth and stored in this mausoleum. If you look carefully, you see over here on the shelf a thermostat and hygrometer. And then down here, you see a humidifier, dehumidifier unit. So my son and I were looking around, and eventually the manager showed up and asked us what we were doing. We told him we were just looking. And I asked him, I said, what are your goals for the indoor air quality in this mausoleum? And he turned to me, he said, well, we want to keep the humidity, the relative humidity, between 40 and 60%, because we find that the corpses do better. And I thought to myself, the corpses do better. What about us? What about before we're corpses? Why aren't we focusing on indoor air quality from the human health perspective? So again, this was a really interesting lesson to me, that we tend to be more careful about our bodies once we've passed away than we do when we're alive. But again, coming back to the financial picture, if you do a cost-benefit analysis of a building and you look at the savings that you get from healthy human beings, whether you're an office building or any sort of commercial business, or say a school, and you're looking, if you're comparing the indoor air quality to academic performance, there are clear correlations and an abundance of data supporting those correlations, showing that good indoor air quality brings up the student average student grades. Or I work a lot with senior living communities, and we find that people live longer in senior communities when the air quality is in a good zone. You have fewer transfers to the hospital by elderly people when the air quality is improved. So if any of you want any help doing a study that looks at the return on investment in a specific building or in a specific vertical industry, I'd be more than happy to talk with you about either monitoring or helping set up a study so you can begin to look at or continue to look at the relationship between indoor air quality, human health, and the business model. So in summary, we found out that managing indoor water vapor is very important for human health. It supports, so I think I'm almost up. And that healthy buildings are a good return on investment. And this is an article I was just reading tonight before this webinar. It came out in Nature, I think it was October 21, looking at climactic signatures of COVID-19 around the world. It's a great article. So now I've come to the conclusion, if you can't measure it, you can't manage it. And this is me, actually. Unfortunately, in both pictures, this is me skydiving. I like to skydive. I do it a lot. And on the left, my altimeter wasn't working. So I was about 200 feet off of where I thought I was. And you can see when I landed, since I wasn't measuring my altitude correctly, I had a terrible landing. It was really embarrassing. Versus on the right, when I know what my altitude is, I can relax, I can have a great time. So we need to manage the indoor environment from this perspective of human health. And thank you so much. And I hope I didn't go over. So we can have questions or whatever comes next.
Yeah. Wow, that's a very interesting presentation, Dr. Stephanie, and we have still much time, plenty of time. And I think that from your presentation, we can take a lesson that's very important to collaborate between medical science and engineering, especially in hospital architect and mechanical engineering also. So I think that good indoor air quality is vital for us. Now, after this pandemic COVID-19, we must consider that the importance of indoor air quality, especially in Indonesia, where TB as an airborne disease still endemic, is very, very important. So, audience, let's see in the Q&A box. There are many questions for you, Dr. Stephanie. I will read it. First from Mr. Yuzuan Zainul. Although the installation of HEPA filter and UVGI may provide clean supply air, however, the exhaled air from the infected person with COVID-19 may transmit to other person before it will exhaust through the return or exhaust grill. How do we tackle this issue in HVAC perspective?
So that's a great question. And you're absolutely right. By managing the air to decrease particles or decrease viruses, we're kind of one step behind because it's already in the air. But this is where it's really important to look at the impact of your filtration or your ultraviolet light disinfection, your temperature, humidity on the person's immune system. Because if the person who's exposed to a virus indoors during that brief time before the virus goes through the whatever your strategy is, if the person inhaling the virus is less vulnerable based on indoor air quality, they're going to have a decreased chance of getting an illness. So yes, we do want to provide clean air to the best of our ability, but you're also right, there's a period of time before potential virus has impacted our strategy where we can also help decrease disease transmission just by supporting the health of people in the building. But that's a great question because it points out both sides of why we want good indoor air quality.
Oh, thank you. The second question from Mr. John Budi Haryato Listiono. USA is the most advanced country in terms of science and technology, medical science and healthcare service. Why is become the most impact of death in COVID-19 pandemic? How can we learn from this condition to improve our future?
Oh my gosh.
This is tough.
That's a tough question. I think there are lots of reasons the United States has done so badly in terms of this pandemic. Some of them I'm not going to even talk about. Some of the political disagreements we have that have led to problems. But for one thing, I think we tend to, as a population, I think it's fair to say that Americans have a less powerful immune system than in other countries. We tend to over-filter our air. We tend to overemphasize hygiene. So I think our immune systems are somewhat impaired. And the other thing in the United States, we're not the only country, but around the world, it's been very difficult for medicine and engineering or architecture to come together to realize the importance of working together. So I was so impressed when I was talking with Dr. Rini before this, and she was telling me about how she works in her hospital to manage indoor air quality to decrease infections. You are so far ahead of the United States because in the US, it's very split for the most part. Medicine's here, engineering's over here. And it's very hard for us to talk to each other. So somehow that's related to Americans, and I don't fully understand the psychology behind our split. But it's a great question.
Yes.
So what can we learn? we can learn that different professions need to talk with each other and work together.
Yes, agree. The third question from Mr. Muhajir Sembodo. He asks how to avoid sick building syndrome due to mostly we do not care about maintaining indoor air quality like room humidity, temperature, air change per hour, and etc. Maybe maximum time, about maximum time to stay at the indoor like that?
So I'm not quite sure the question. Can you help me understand the question?
Yes. How to avoid sick building syndrome due to mostly we do not care about maintaining indoor air quality like room humidity, temperature, and air change per hour. So how long that we can stay at the indoor like that?
So again, I'm not 100% clear about the question, but I think you're saying, how do we avoid the symptoms of sick buildings? Do we avoid
Yes.
the symptoms by not staying in a building for too long? Is that the question?
Yes, yes.
I think the answer is, again, to improve indoor air quality, because sometimes we have to stay in buildings for a long time. If you're in school or we live there. My solution to the question that I think is being asked, my solution is to, again, I'm very committed to the concept of monitoring our buildings so that we can actually create visibility around what might be making us sick. Because if you monitor these different components, you can see what it is that is causing the sick building syndrome symptoms. So I think it's important not just to focus on one, but to look at how these things work together and can make us feel or be sick. But I'm not 100% sure that I answered your question, because I'm not 100% sure I understand the question.
Yes, I think Mr. Muhajir can ask another question or clear the question after this.
And you can email me too, and I'd be happy to
Yes.
talk some more.
Okay. So this is from Mr. Nurhadi Adi Andoyo. I know health aspect is important thing, and I know most of the building didn't meet requirement for sustainable health building indeed. I assume part of the difficulty about health building is pricey. Definitely, it's our struggle as a development country. But I believe in the future, many of us would notice how important health building is. So can you encourage us to have another side to make deal with old mindset?
So I don't see an old mindset here, but what I do see is the thinking that that new or expensive buildings to either build or maintain are the ones that are healthy, and we don't know that. It's, we're finding that some buildings that are made with local materials, wood, stone, the vernacular architecture actually has better indoor air quality than a high-rise building that's all sealed up. So we can't really correlate expensive buildings with healthy buildings. And so again, that's why I'm excited by the fact that medicine and engineering is beginning to work together so we can do studies to measure the indoor environment, measure human health, and then understand in each building what's going on. Because often a wooden building that's very leaky or a concrete building will have better indoor air quality than a glass and steel high-rise. So
Okay.
don't make the assumption that it has to be an expensive building to be a healthy building.
Yes. And the next question I comment from Mr. Muhammad Hazah bin Siron and Mr. Paul Wijaya, because it's a little bit conjunction question. Do the infection rates also depend on the ambient temperature? And on the chart of room humidity and number of infection, does it also apply to tropical countries where our room humidity is high? Does it apply to tropical disease as well?
So you put two questions together.
Yes, yes.
So infection rates do depend on mostly on the outdoor ambient temperature. But when you think about outdoor temperatures and bringing that air into your building and heating or cooling it to a comfortable temperature, it really is much more the relative humidity that impacts our health or disease than the temperature. The temperature has some correlation, but it's really the changes in the relative humidity that are associated with heating or cooling air that affect our health. And then in the next question, where I see about a question about tropical countries and relative humidity. And in tropical countries where the relative humidity indoors is over 60%, we don't see the seasonal swings, the same seasonal swings in either influenza or nosocomial infections. It doesn't mean we don't have infections, but they tend to, contact transmission seems to be a bigger component in higher humidity countries. So again, surface cleaning is important when you have higher humidity indoors. But we don't see the seasonal swings, which is really interesting.
Yes. And the next question from Mr. Muhammad Hazah bin Siron again. 100 micron droplets won't be able to be airborne. Thus, in my opinion, it will reduce the infectivity rates. How about your opinion?
I totally agree. Again, if you have the humidity where the 100 micron droplets aren't shrinking very much, you just have to be careful with surface hygiene. But I agree with you. You have fewer cases of airborne infection.
Yep. And from Ms. Elsha Asafira, according to ASHRAE, we must measure airspeed or movement at 3 points per zones. Example, 0.1, 0.6, and 1.1 meter levels for sedentary occupants. My question, from health point of view, would it be acceptable to focus on the breathing zone area, example 1.1 meter?
Yeah, I say yes. And in our studies with our monitoring, we do focus on the breathing zone, and it seems to be the most important. That does seem like the most important area to monitor or to manage. So yes.
And from Mr. Christopher Sukrisman, do we really need to install HEPA filter in the office building in terms to prevent COVID-19? Is it effective?
You're trying to get me in trouble. I think, it depends on the other parameters in an office building, but I think we need to continue to think about filtration. Again, this next sentence is not going to be an ASHRAE sentence. My personal experience and opinion is that humidification is humidity management is the most important factor to manage, but I do think we have to include HEPA filtration to decrease potentially infectious particles and also to decrease particles in general, because higher particles, no matter what they're made of, tend to be associated with higher infection rates. So I don't think we can forsake filtration. So I do think it's effective, but it's not the only solution.
Okay, thank you, Dr. Stephanie. And from another question is from anonymous attendee, because there is no name there. There's two questions. What is the average room temperature, room humidity in the Indonesian climate? And the second, how can people as generally average Joy, not scientists, measure room humidity in our surroundings? With what tools? Oh, I don't understand exactly what the second question, but maybe you can understand that. Dr. Stephanie, please.
So Yeah, I think I understand that. And I actually was doing a little bit of investigation. And I believe in your dry season, your indoor humidity is in a very good range, from what I could read. But to measure it, I mean, the way I measure my indoor humidity is I have our sensor. This is what we use in our business to monitor, that measures all sorts of things, the 9 different metrics. But I also have a little, little hygrometer that costs about $5. This one happens to be Condair, if you can see it. And it tells me the temperature and the relative humidity. The relative humidity in my office right now is 37%, so it's a tiny bit low. So you can get these, they're inexpensive, and you can monitor your temperature and humidity. Or if you happen to be particularly industrious, you could build a wet bulb, dry bulb hygrometer and put a fan on it and make an old-fashioned hygrometer. I can send you a link to how to do that if you want.
Thank you. And for another question that I jump to question from Mr. Lutfi Landrian. Thanks for the good explanation, Dr. Stephanie. What is the best strategies needed for indoor air quality management, especially to manage room humidity in an auditorium or theater in the tropics, especially if we use natural ventilation instead of HVAC system, refer to this pandemic situation and energy efficiency?
So I am not an expert on, I can talk about the importance of humidity management, but I'm not the best person to tell you how to do it. So I know if you have high humidity, like over 60%, you can, there are different strategies, desiccant dehumidifiers. But again, I think to answer that, you had best talk with one of your engineering colleagues, because I can't give you as good an answer as they will give you. I apologize. I can just tell you why, not how.
Yes, no problem. Because we are medical, since we are still medical doctor, not an engineering, totally. There's a question again from Mystika Hanjan. Hi, thank you for a great presentation. Can you share your thoughts on healthy building, as it may need to certain consideration for energy usage, especially if we use mechanical ventilation, since we all know natural ventilation has limitation, while in the other side, we try to reduce our carbon usage. Thank you.
Well, thank you for saying it was a good presentation. I think from my perspective, one of the most important components is to measure the indoor components that affect our health. Measure particles, measure gases, measure humidity and temperature, because if you implement a strategy, whether it's ultraviolet light or filtration or outdoor air ventilation, unless you monitor the indoor air quality, you're not going to know when you need to turn on your strategy, when you need to turn it off. So just like CO2 levels being used for demand ventilation, I think it's really important for us to create visibility into the health impact so that we know what to do, we know when to do it and when not to do it. And I think that's one of the biggest energy savings is to have that visibility and understanding.
Yes. And another question from Dodi Adam. How you would see the building management improvement regarding air quality for commercial building regarding SARS issues?
So how has this pandemic changed indoor air management? Is that what the question is, do you think?
Yes, I think so.
Yeah. Well,
I don't know about SARS issues.
I think SARS is
SARS virus.
SARS-CoV-2.
Okay. Yes, yes.
You know, as this pandemic has been tragic in many ways, you know, economically, human life, all sorts of consequences. But I think the silver lining, or if we want to look for some benefit from the pandemic, I think in a few short years, it has focused our attention on how important indoor air management is. And without the pandemic, it could have taken us another 50 years. And as you know, Rini, tuberculosis and other airborne diseases are exact a great toll in human life. So I think that we have really become aware of how important it is to manage indoor air, to decrease viral transmission. I think it's accelerated our understanding of that.
Yes, I agree with that. There's a question from Doni Cahyadi. Do you know if this room humidity criteria is properly implemented by air carrier inside an aircraft, as it is being very close containment environment packed with people?
Airplanes are terrible in this way. Airplanes are so dry. I don't know about you, but if you go on a fairly long airplane flight over a couple hours, how many people get sick? You know, air cabins are very, very dry, and we know that there's a tremendous amount of particle suspension and resuspension. So if one person is sick, it's that pathogen can be spread quite far and wide. There are other problems when you fly. You know, you're supposed to get up and walk around if it's a long flight, drink lots of water, because your blood clotting is increased in a low humidity environment like that. So aircraft carriers are very hard on our health.
I see. It's interesting.
I travel a lot, and I
Yes. Okay, I believe that. And this is from our senior, Mr. Dedi Al-Rashid. Hi, Dr. Stephanie. Is air change per hour may substitute air change per hour if ventilation rate couldn't be improved to technical issue?
Yes. Effective air change rates, it's a great concept, and it's an opportunity to move from just an absolute air change rate to an effective air change rate. And so, yes, I think it's a very good strategy. Again, I'm a believer in monitoring particles and gas levels so that you know what an effective air change rate is based on health metrics. But yes, I think effective air change rate is a good substitution for absolute air change rate.
Thank you. And from another person, Doctor, can you provide short insight regarding air circulation and airflow?
I'm not exactly sure what the question is, but I do know that air circulation in a given building or even within a given room can be quite variable. And so if you are going to do studies or monitoring or measurements, choose a part of your building or your space that is representative as best you can of what people are breathing. Because again, air circulation, air mixing is different in different parts of a building or room.
Well, Dr. Stephanie, there is so many questions, and we still have 9 minutes to a discussion. I read from Mr. Tuan Giang. Can we use ionizer to improve IAQ since it can kill bacteria and virus?
So when I think about a question like that, and when I look at different air cleaning technologies, I look in the literature for peer-reviewed studies. And with, for example, bipolar ionization, I have not found enough peer-reviewed studies for me to be comfortable promoting bipolar. The theory sounds great about decreasing particles by these opposite charges, making small particles stick together, but I just haven't seen documented results that support the claims. So I myself am careful, and I don't use ionizing technology because despite claims that ozone is not produced, we've often found that ozone is produced, and ionizing solutions don't always decrease the particles as claimed.
Yes.
Many people like it.
Yeah.
I would just like to see more studies before I can wholeheartedly recommend it.
Okay. Thank you, Doctor. And from Mr. Arifin Hidayat, how to compare if we manage for humidity with investment of dehumidifier? May you give us calculation about ROE, return of investment, if we will install the dehumidifier?
So yes, I mean, great question. From an infectious disease transmission perspective, high humidity is better than low humidity. I have some data on what happens over 60%, and I'd be happy to share those data points with you. But from the perspective of disease transmission, it's really the low humidities that's the most dangerous. Having said that, I will share with you the data I do have on high humidity and the benefits of a dehumidifier. I'd be happy to if you could you email me and I can send you my data on that.
Okay, Mr. Arifin Hidayat. So please note, please type your email to Dr. Stephanie.
Should I put it in the chat?
Yes.
Okay. You can also, or you have my presentation, so you can, where do I put it? Wait a sec. I'm having trouble. Oh, there it is.
Yes, you put your email in your presentation.
Yes, and I'll put it here
So-
again.
So Mr. Arifin Hidayat can email you.
And I'd be happy to share, you can obviously have this presentation, but if you would like my input on setting up a study or any other question, I'd be very happy to help.
Great,
Okay.
thank you for that, Dr. Stephanie. And from Ms. Rizalinda Shahrial, would opening window every several hours help to dilute air pollutant in an air-conditioned room? Or would the air conditioner filter do that job?
It depends on, again, I sound like I'm saying the same thing. I think you need to monitor what the particles or the CO2, because depending on how big the windows are and their placement, how much, if you have cross ventilation or not, how effective outdoor air fractions are compared to the air conditioning filter. Filters don't remove, unless you have a carbon filter, filters don't remove the gas pollutants. They're more effective with particles. So again, to answer that question, I think you really, again, you need to think about what you're trying to remove and have some way of monitoring that. So I don't really know how to answer that accurately.
Okay, thank you. We have still 5 minutes, and I will choose question, and I will not read all the questions. From Ms. Anggun Putra Utama, dear Dr. Stephanie, to get 40 until 60% room humidity in tropical country need a lot of energy. Could give the suggest how to optimize this condition? Thank you.
I'm sorry, could you ask the question again? I was not understanding it. How to manage more 40 to 60?
Yes. Because we are in tropical country, the humidity is high. So how can we get 40 until 60% room humidity?
So I'm going to turn that one to one of your engineering colleagues. Again, I can't give as good an answer about how to do this as why to do it. But again, in general, desiccant dehumidification or other strategies, but I'm not the best person to answer that question. An engineer, I don't know And I know that we're not supposed to be business oriented in ASHRAE, but I bet one of your colleagues knows more about dehumidification than I do.
Okay, then. And this is maybe the last question, and I think it's very interesting because out of the box question. Can Himalayan salt or lamp improve the air quality at the office? Himalayan salt.
Wait, say that. Will you say that again? I was reading a different question. Sorry.
Okay. Can Himalayan salt or lamp improve the air quality of the office?
Could what improve it?
This is a salt.
Oh, I see. There it is. I don't know. I'm not familiar. And what does Mr. Villar, is that?
Yes,
I'd be
Leonardo
interested
Villar.
in what he thinks.
Maybe he thinks that salt can reduce the microbes.
Well, you know what? There's actually a very good study that's looking at aerosolized. It looks at a humidifier that uses salts I can find and send. I think that's a very interesting question, and I'm not 100% sure of the answer, but I can send a study. So will you, if you'll email me, I'll be happy to send it back, send the study to you.
Okay, then thank you very much, Dr. Stephanie. And I think that's all. Finish.
Great questions. The
Yes.
best questions I think I've ever been asked.
Okay. And for the other question that I not read, Dr. Stephanie will type the answer and email to the participant from the email that you sent to her. Well, the audience and Dr. Stephanie, I think we are in the end of the session 1, and it's a very interesting and very honor to have the presentation from you. Well, it's a very great presentation, and
Thank you so much.
Make a new insight for us, especially for medical fields, because there is, I think that's in who attend here, there is many college from me, and there are medical professionals. So
that's fantastic.
Yes, so I hope that many of them will enjoy and will join ASHRAE Indonesia chapter also, so we can conduct the indoor air quality with much better in Indonesia and in our building also. So audience, this is our end session 1. So let's give applause to Dr. Stephanie with a virtual applause, of course. And thank you so much, Dr. Stephanie. I hope we can meet in another session or another meeting with you.
Thank you so much.
Thank you so much.
Maybe I can come to your country and see you.
Yes, of course, you must.
Thank you very much.
Thank you very much also. And audience, we are in the second session. So I introduce you with a speaker from AAF, that Mr. Raymond Wong is AAF Asia Segment and Product General Manager, who has more than 15 years of experience in the air filtration business. He is also one of AAF company's directors in our Singapore office, and he is competent in clean room mechanical services, IAQ, risk management, and also a certified construction safety project manager. And he has an extensive project experience in biopharma, microelectronics, and also hospital, that is in Farrer Park, Raffles, Mount Elizabeth, Singapore Changi Hospital, and etc. and is capable of providing clean air solution. He is also an experienced certified trainer conducting annual training for staff related to products and technical skills under Clean Air University. So this session 2, Mr. Raymond Wong will talk about air quality plays a vital role. The time is yours, Mr. Raymond, please.
Thank you, Dr. Rennie. We also thank you to this Dr. Stephanie for the good presentation earlier. Okay, let me share my slide. Okay, hope everyone can see my slide.
Yes, we can, Mr. Raymond.
Okay, perfect. Okay, without further ado, we will go to share to you today the air quality plays a vital role in our daily life, okay, especially during this current pandemic that everyone is experiencing now. Okay, today we will share with you the importance of clean air, the important facts of air leakages, okay, and how technology can help. Let me get my laser out first. Okay. Okay, the importance of air. Why air is important to us? Okay, we shall take a look now. Okay, per day we consume about 1 kg of food. Okay, we drink about 2 to 3 kgs of fluids per day. However, we inhale about 15 to 20 kgs of air per day. Okay, we are converting it to kg for easy identification and for easy understanding also. Okay, on top of that, of not only the 15 to 20 kg of air per day that we inhale in, okay, we also do not neglect the presence of other gases in the air too, like VOC, formaldehyde, total VOC, etc. Right, this is all among the gas. Okay, and more importantly, because during the current pandemics, we are spending more than 90% of our time indoor. So this is important to keep our air clean. Okay, right now what you see here, okay, all the pictures are, okay, smoke is particles. So when you are experiencing yourself or come into contact with such situations, do something about yourself, stay safe, or move away from them, right? Okay, later we have some solutions to share with you how you can do it, okay, with some sequence. Okay, there's some, I think, 4 procedures that you can apply with if you come into a situation where you don't know what to do. Okay, stay tuned. Okay, next, the importance of the clean air. Okay, what will happen if you don't upkeep the air clean? Okay, the respiratory systems of ourselves, okay, will be impacted. Okay, this illustration shows you the aerodynamic diameters of particles and their likely regions of deposit. Okay, if you don't take care of them, where will that be deposit? In our respiratory systems. Okay, under the ISO 16890, this is a global news filtration standards. Okay, they have identified the 3 common particles as PM1, PM2.5, and PM10. Right. So now let us take a look on what's the likely regions of deposit. Okay, if we don't handle them well. Okay, let's take a look at the PM10. Okay, based on PM10, so we inhale from the nose. Okay, but PM10, due to the size of the particles, they were mostly landed in our trachea. Okay, next we take a look on the PM2.5. Okay, smaller particles than PM10, and their likely regions of deposit will be, okay, our bronchioles, right? And next we look at the smaller particles, that is PM1. They will land even much deeper and into the alveoli. So from here, the illustrations, if you don't take care of the particles, okay, especially PM1, okay, because PM1, the smaller the particles is most dangerous because it landed even deeper into our lung. So the particles get into our lungs, I would say there is no way you can remove it. So that is important to keep our air clean. Okay. On top of that, the classifications of the ISO 16890 is oriented towards the regions of deposit in the human lungs. So that is, this is a new standard, is based on global. So that will practice globally. So you can buy from US or Europe or Asia. Okay, as long as you specify ISO 16890, you will get the same standard. Compared to current, we have X-ray, we got European. Okay, X-ray and European, you only have cross-reference. Whereas X-ray and European, you cannot cross-reference to ISO because ISO is based on mass, while X-ray and European is based on particle count. Okay, so they are totally different things. So there's no direct conversion or crossover. Okay. Okay, let's move on. Okay, now we take a look on the impact of the ignorance on regular maintenance. Right, this is the old problem. No cleaning or ventilations will be short-lived. Okay, we do hope that everybody agree. You can see from these pictures here, this is due to the ignorance of the maintenance. You can see here, all the dust have been clogging up and they, okay, so the machines were not able to, what I call lifespan as per design. Okay, so therefore it's important to keep the system clean, right? So by keeping the system clean, what will you be enjoying? Okay, you will be having to keep the design airflows to make the influence of temperature and RH, reduce indoor contaminants from humans, building materials and equipment, right? Okay, next, you will enjoy keeping the efficiency of the equipment. So there's no breakdowns or the frequency is reduced for breaking down, right? Especially the fans, heatings and cooling, etc. Okay, what happens if you don't keep them clean? Okay, your fan will be clogged. What happens when they clog? You reduce your airflows, right? And the heatings and coolings, the apertures, what they will do, okay, they will not perform as what they are being designed for. Okay. Okay, the next is you will keep your indoor surfaces clean. Okay, avoid microorganisms in the system, and it will remove the outdoor contaminants. So therefore, it's important to not neglect the regular maintenance on any systems that you're having now. Okay, so this photo is show you that there's a gap. Okay, through our experience, there's a lot of maintenance or area that we visit. Okay, we are very surprised that nobody do about anything about the gap they see. Okay, but however, today we will share you the impact. Okay, and this gap is what we call a bypass. It's a common problem. Okay, but now it is more critical than ever. Why? Okay, later will tell you the reason why. Okay, if you had 1 mm gap, okay, 1 mm gaps in the installations of a F9 filters, okay, it can reduce its efficiency to F8. That means it will downgrade from F9 to F8. Oh, so just with 1 mm gap. So it's critical, right? So what happens if you have more? Okay, we have 10 mm gaps. Okay, it can drop 2 grades of a G4 filters rated under the EN779 to G1. That means you will downgrade to 2 grade lower. Okay, from F9, you will downgrade to F7 with just 10 mm. So this is very, very critical, right? And it's even more critical because due to the current pandemic, okay, so we should eliminate all these 1 mm and 10 mm because otherwise the bacteria or the virus will come and say hello to you, okay? And especially onto the industrial regulatory guideline like ASHRAE and CDC, okay? They are promoting or they are encouraging the user to upgrade their filtrations, okay, to prevent, to keep them, reduce the risk of getting the virus. So, see, the reason here is the higher the efficiency of a filter typically is having a higher resistance. Therefore, bypassing in those filters is more adversely affected, right? Because the air is very, very smart, okay? They will not go through the area where there's higher resistance. They will always go to the least resistance, right? So imagine all the air will rush through here. And what happened? The air contains bacterial, virus, and all these contaminants. So it will say hello to you, right? So it's important to keep our air clean, right? Okay, the challenges of having a good IAQ, okay? Here there's some experience that we've shared to you. There isn't any straight or right answer to have a good indoor air quality. Okay, why? Because due to the design and due to the facilities, existing facilities, that you are not able to upgrade or you're not able to do any changes, or because of the limitation of the space or the condition, right? An ideal solution for buildings will vary across the building types and geographic locations, right? There are also different region from region. There's a different and different changes, different environment. Focus on the air filtration, ventilations, temperature and humidity controls, and the potential supplementary. The keyword here is the supplementary air cleaning technologies. Okay, that would be another solutions to fill the gaps. Right. Okay, the industrial regulatory guideline, okay, by ASHRAE, as I mentioned earlier. See, they have, because due to the current pandemic, okay, whatever filtrations you have using now, okay, minimums they will ask to upgrade or they recommend to upgrade or to move to MERV 13. Okay, this is ASHRAE, and under the European is called F7, right? So you have G4, F7, okay, or you can MERV 8, MERV 13, right? This is a minimum, or the best if you can move to higher grade is the G4 or the MERV 8 to MERV 14, G4 to F8, okay? If your current systems, especially the fan static, is able to take, okay? So upgrading is not so simple, just upgrading. So make sure you do your study evaluations, especially your fan system or the fan motor static, able to cope with the new additional static, because higher efficiency filter will have higher resistance, right? Whereas compared to the CDC also have the similar recommendations, okay, minimum filtrations, okay, is G4, F7, or MERV 8, MERV 13, right? 2 stages, okay? And the what I call this importance we are emphasizing here is air filtrations is moving from occupants' comfort to life safety, right? Because due to the current pandemics, we are saving life. Okay, if you do upgrade these filtrations, okay, you will reduce your risk. Okay, so now we will tell you the advantages or what the benefit you will enjoy. Okay, to reduce your risk by following the recommendation from the industrial regulatory guideline like ASHRAE or CDC. Okay, so look at the left-hand corner here, or the first column here, the existing filter. You only got single stage, right? You have MERV 7. Okay, in general, this is ASHRAE MERV 7. If you convert to EN, is about G4. Okay, so you will have 7 times of circulation in order to achieve the air cleanliness you want. However, with the new proposal, okay, you move it to F7. Okay, MERV 13 is F7. Okay, you will reduce from 7 times to 2 times. Okay, that will reduce your risk, right, from coming into contact with all the contaminants. Okay, so this is it happen if you have a single stage of filtrations, right? So of course, with the upgrading, you will face a higher initial resistance, so that you need to compensate. Okay. So next up, let's take a look on if you have 2 stages of filtrations. Okay, so there's a combination of pre-filters and mid-range filters. That means we will layman term, we call it pre-filters, secondary filters. Okay, so if existing pre-filters, we have MERV 7 or MERV 8. Okay, existing is MERV 13 or MERV 16. Okay, so if you have proposal based on our proposal of upgrading to MERV 11 and MERV 16, that means if M5 to F9. Okay, if you upgrade that, you will reduce your circulations to 1 times. Okay, rather than you got more many times from here. So this is one of the advantages and the benefit we will show you, okay, from the benefit of upgrading, and also at the same time reduce the risk, okay, with higher efficiency filters. Of course, please take note of here, because of this you need to compensate. So there's a pro and con, but I would what we will say is this is worth to do the upgrading, because why? Okay, we are moving from comfort to life safety. Okay, next we take a look on to show you further from the advantages. Okay, those who are not so clear with the earlier slide, that what is the benefit, and now we show you through the particles. Okay, and this will give you a better understanding of what I've illustrated earlier. Okay, let's take a look at the particle range. Okay, 0.55 to 0.7, right? So this column here will show you the particles capture rate, right? So the capture rate, okay? Let's assume we have 100K of particles, okay? Before we come to penetration, okay, this is the 100K. So 100K was released upstream of the filters, okay? So out of 100K, 83 or 84% will be captured if you have MERV 14, okay? So MERV 16 will be captured 99%, 93%, so, right? So higher grade of filters, okay, have better efficiency and they do the job better, okay? So you have still confused using this one. Let's go through these penetrations, right? So penetration, you can see here is 100K of particle release. MERV 14 is able to capture, it allows 16,100 to pass through. Penetrate means pass through, okay? If you upgrade from MERV 14 to MERV 16, what would be the impact? Okay, so only 700 pass through. So we will say your risk had reduced, okay, 23 times. Okay, so hopefully this gives you a better idea and also encourage you to do the necessary upgrading, because that will protect you. Okay, so this is an illustration. We'll show you the impact of upgrading from a lower efficiency to higher efficiency. Okay, the objective is to reduce your risk, right? Reduce your risk, especially current pandemic we are experiencing now. Okay, let's move on. Okay, starting beginning, we mentioned if you're not sure when you encounter a situation that you face with some hazard or the contaminants that you don't know what to do, here is the sums of the recommended way you can improve your IAQ, right? So this is the approach of solving the IAQ, okay, or the contaminations problems. Okay, let's just take a look at what it is. Okay, in any situations, right, don't be panicked. First, stay calm. You must identify the source. What are we dealing with? So need identification, make clear what you are doing, okay? So you need to identify them, right? So we're referring to air. So you're not sure what you're doing, and like say indoor IAQ. So engage a third party to do a air sampling test, right? So with the data, so with the data, then you can think of you either using administrative control to reduce the particles contaminations through training and educate the staff, right? So first step is use administrative control. So if not effective, okay, you use engineering control, okay, to stop the pathogens from spreading. So maybe you need to buy more equipment, you need to do some upgradings of the system or modify the systems, okay? So based on the data you have captured, right? If that's not working well, okay, so you need to have substitutions, okay? That's where you need to do some upgrading or supplementary systems to come into place, okay? And the last one, the best solution is possible, okay? You totally remove them, eliminate them, okay? So elimination doesn't mean that totally give up or don't use. You can actually contain the other places, okay? So that will be the some of the proactive actions that we'll recommend to you that you implement into immediate practice. Okay, of course, if you're in doubt, okay, working on the air filtration is the #1 initiative actions you should prioritize first. Like during the pandemic or during any emergency, okay, you need to prioritize your initiative also, right? Okay, so during this current pandemic, okay, there's a lot of panic and a lot of questions we receive filtrations, okay, versus viruses. So now we share with some of the takeaway here. Air filtration captured virus as size-based, okay, respiratory droplets. That's what we call. So when virus, they're airborne, they always piggyback on the droplets. So that is where they call it respiratory droplets. So what is in the droplet? The size are much, much bigger, which are air filtrations is able to do the job, right? Virus always enclosed in the larger droplets in the air. So when they're mixing, so enclosed, in other words, is piggyback, right? They are piggyback, okay? And once they're piggyback, they're moving as a form of an aerosol, just like our testing aerosol, a PAO, DEHS. Okay, so they have size, right? So it's aerosolized particles. Okay, so during coughing, the droplets are 10 times larger, over 10 microns. So that filtration easily can handle, right? So with the above of for the safe droplets, HEPA filter with H14 efficiency is good recommendations, okay, especially with the media EFRM, right? H14 is a good practice. Why? Okay. So based on this graph and based on the most penetrating particle size, MPPS is the most penetrating particle size. That means most commonly particle size, right? We compare comparison to the traditional glass fibers and the new membrane we call PDFE or EFRM, right? Okay, so take a look at the traditional. The glass media, the most penetrating particle size is 0.13. Okay, that's where they are commonly captured, right? Okay, when we look at the red curve here, under the new membrane, EPDFE, okay, their MPPS is at 0.07 microns. Okay, much more stringent tests and performance. So therefore is a better choice for current pandemic, right? So if you need to know more, there's a link for you to read more from here, okay? Okay, let's move on. Okay, we are talking about so much of the filtration, talk about good things to do. However, okay, a product, a filtration product, you need to have to go through a auto scanner report, a scanner systems, okay, like this. You need to have a true, what we call state-of-the-art technology, okay, to evaluate your products, okay. So you need to scan it 100%, okay, the media area you scan 100%, make sure the product live up to their specifications. Then you will combine with the scanner reports, pack together with the products and ship it to the customer. So when the customer receives this, they are also being assured that the products are leak-free. Okay, with this report are leak-free. This is 100% scan report. Okay, on top of that, okay, you also need to have what they call this a test equipment or test grid, okay, to do the necessary tests so that your filters are in a good shape. Okay, so all these equipments that we this for the product testing is compliant to ISO 16890 or the EN or the ASHRAE. Okay, so of course under the under the ISO 16890, okay, we need to have two conditions. One is charge condition and one is discharge conditions. So that's why you require this discharge chamber, okay, for the ISO purpose. Okay, so whatever products you buy, okay, so you need to have a very good document to support that the product are being designed live up to its name. Okay, next let's take a look how technology can help, okay, especially to fill up the gaps. All right. Okay, just imagine this is the existing buildings, okay, that they are doing the what they call it air circulations. Okay, normally the buildings, they will have like under the ASHRAE guideline, you have a 6 air change for office buildings. So everybody know, when you move into a buildings, when you have furnitures, cabinets, everything, okay, the air cleanliness or the air filtrations or circulation will not cover evenly or perfectly. Okay, so there's somewhere, somehow there's a gap. What happened? Okay, so if you have the virus, assuming your 3-hour life, and then you have a 6 air change, 6 times of air change per hour, okay, and your virus have 3 hours life. So what happened? You got 18 times or 18 chances to say hello to the virus, because sure, in the office, you can look around your office, sure there's a dead pocket, sure there's air circulation is not good. So this is where you need to have technology to fill the gaps, okay, in the air purifications. All right, so this is important. Okay, other than you upgrade your filtration, that is a primary step to do. Okay, but before you upgrade, make sure you ensure your filter static, the fan static is sufficient. Okay, for existing system. For a new system, you can tell a supplier to comply, right? Okay, so what is the core value if you have like a supplementary equipment to do the jobs? Okay, so to fill up the gaps, okay, we recommend you get a standalone, mobile, self-contained unit suitable for indoor or outdoor. So of course, outdoor you have to be sheltered, okay? Designed with combinations of HEPA, gas phase means chemical filters, okay, to remove your odor, remove your VOC, remove your unwanted contaminants, and optional UV, germicidal irritations. In short, we call it UVGI. Okay, so a lot of people call it UVC like, okay, something like this, right? So design with variable fan speed. Why we need a fan speed? Because if your area is small, you don't need to have airflow. If your unit is bigger, you can increase the airflow. Or when there is more people in the office, you can turn it to a high fan, right? So insulated double wall housing constructions, whisper quiet operations, plug and play concept, easy installation, operation, and maintenance. Supplementary, that is a keyword here, supplementary, because they do not need to incorporate with any of the existing equipment to work, right? So they are standalone. Okay, 100% leak-free tested on the housing, new membrane medias, okay, what we mentioned earlier, the PDFE or EFRM, okay, is included, right, in the systems. And the latest one is the antimicrobial media is also available that we are able to inactivate the virus. So this is the first choice for filling the gaps where your existing systems cannot serve. Okay, so the keyword here is the first choice for filling the gaps where your existing systems cannot serve. Okay, so this is show you how this make use of these systems to fill the gap by turning the rooms into a negative pressure. Okay, if the situations arise, right? So what you need to do is you just have to suck up the air from the rooms, of course, with the proper filtration, filter the contaminants, okay, and let the clean air or the safe air out to the environment without touching your existing equipment. Right, so they're standalones. So you have a control, we can be wired remotely to the area that you like to control on off, and also monitoring the status of the particles. Okay, that it can be done. Like this, so this is one way to turn your room into a negative pressure. Okay, what happens if you want to turn to a room to a positive pressure? Okay, the system is able to do so, okay, by having sucking in the fresh air from the outdoor, okay, filtered by HEPA, okay, before it being supplied into the rooms. Okay, so you can circulate it. So this is how you turn into the positive room. But remember, do not over bring in the fresh air. Okay, you need to calculate properly, okay, as a safety factors, because otherwise, if you over pressurize it, okay, you may have the concern of your door. Okay, either it's not able to close or not able to open. Okay, it depends on your door swinging positions. Okay, so you need to size it properly, because otherwise you already have this issue. Okay, either you cannot close or you cannot open the door. Okay, Or the worst still is, okay, you may have your wall showing crack because the pressure is too high that you make the wall bulge. Okay, so that has to be careful. Okay, and if you had the situations where you had limited choice, okay, that to do any upgrading on the existing systems, okay, supplementary equipment is the best choice. Okay, and this is where mostly we apply for this office where you need a nice aesthetic view. So you height above your ceiling. So what you do is, okay, one end you're sucking the rooms filtered by HEPA filters and deliver a clean, fresh air into the room. So this is how you recirculate it. Okay, so doing this recirculation is also to increase your air change, also reduce your risk, okay, at the same time, right? So this is how you do it. Okay, recirculation, you have a like above the ceiling is one of the methods. Okay, there's other methods that you can do recirculations as well if you have constraint on the space above your ceiling. So this is another type where they call it vertical flows. Okay, you do similar. Okay, if you have constraint on the above the ceiling, there's no space for the hang. So this is the types that you can do it, right? Recirculations. So you deliver the clean air, circulate, and bring out the contaminant air back, filter through, and recirculate back again. Okay. Yeah, so much on the filling up the gaps on the recirculations. Okay, another methods that we can show it to you or share it to you is to use a systems that you can remotely monitor the air cleanliness or the conditions of your filtrations. Okay, by using the IoT. Okay, currently, nowadays is all the IoT do the docking now. So the benefit of having the IoT or the sensor, okay, that you reduce your manpower from moving your office all the way to the site. If let's say you got more than 300 ASU, so that you have to mobilize a lot of manpower. But having this sensor, okay, you can have your convenient or in the comfort of the office through the mobile or through a desktop. Okay, what you can monitor is your current pressure drops, your optimized change point, your life remaining, your total cost of ownership status, your life cycle consumed, and most importantly, your energy usage. Okay, with all this data in your comfort in your office, right? So what happened is the sensor will capture the data. Okay, so they send it to the gateway. The gateway will send it to the clouds, and once the cloud, you push to the user either desktop or mobile. So you can monitor the conditions of your air cleanliness in your office anytime, anywhere. Okay, even you're on leave. Okay, so this is the advantages of having the IoT. Right. Okay, next, we do have the total cost of diagnostic. Okay, that's in short we call it TCOD. So it's a software that is a comparison of different filter solutions over the total cost of ownership simulations. So what this can do is, if you like to upgrade your filtrations, you don't know what to do. Okay, whether the brand A, brand B, or C is better. So what you need to do is you have the existing filtration systems. Okay, and then you key in A or B, right? Then with the simulations and with the what they call it, the factors inside, when you run it, okay, it will show you the data. Okay, either the investment cost, your energy cost, your disposable cost, your maintenance cost. All it will tell you which are the best. Okay, so this will be give you a graph where for you to make decisions, right? So to show you which are the economy or most optimum or economy point to change your filter through a certain years of lifespan. Let's say 3 years, 5 years. Okay, so we'll tell you exactly how much to invest. Okay, let's say 5 years down the road. So that it will give you a budgetary of, okay, accrue. Okay, so all this software, we through the 5 critical factors, not only one, is through 5 critical factors that make up of the total cost of diagnostic. Okay, the 5 factors are your investment cost. That means the cost of buying the products. Okay, so buying the products. Second thing is this product, what is the energy cost if you run it for 5 years, right? The third one is the cleaning cost. Because if the performance or the efficiency of the products is not good, okay, your cleaning costs will increase. Okay. The fourth one is replacement cost, right? So if your choke out rate is so fast that you keep your frequency of replacement is also very fast. So what happened? Then you need to replace it more frequently. More frequently, your cost also go up. Okay. So this is the number 4 criticals. And the last one is disposable cost, right? So you change it more, you clean it more, you also incur your disposable cost. So only with these 5 factors at the same time stimulate, okay, then it will be meaningful to consider as total cost of ownerships. Okay, we know in the market that is something that they only look at energy costs. Okay, the rest they all forget. But that will not be a true evaluation. Okay, a true evaluation, you must have all these factors, okay, put into pictures. Then you will consider optimum points or optimum solutions to apply. Okay. Okay, thank you. So we have come to my end of my presentations.
Thank you very much. It's very interesting, Mr. Raymond. We have that problem too in our installation, and IoT, I think it's very awesome because it's very difficult to control your installation, your filter installation in upstairs.
Yep.
Yes. Okay, audience. This is Mr. Raymond already finished the presentation, and now we will have a discussion. Okay, I will see in the Q&A box there is a question for you, Mr. Raymond, from I don't know, Mr. Ganis Ramadhani to Pak Raymond. As far as you know, is there any country that they implement to measure the indoor air quality in regular by government law enforcement? We did some, but mostly in private sector by voluntary for their specific purposes, and others for safety concerning to the explosion or fire hazards only, but not concern for human health. Thank you. Okay, Mr. Raymond.
That is a very long, complicated question.
No.
I am not able to catch.
Maybe I will read then with the first question. Is there any country that they implement to measure the indoor air quality irregular by government law enforcement? Is there any country that already implement the indoor air quality regular by government law?
By government law. Okay, I try to answer this question based on my understanding of the question. Oh, as far as I know, is there any country that implement to measure the? Okay, I believe, okay, I assume they're talking about the regulatory guideline. Okay. If I'm not wrong, most of the country have their own set of what they call IAQ regulations guideline for all these consultants and all these practitioners to follow. Yeah. Okay. If you're not sure or if you're not aware what to do, okay, I will what we will say is you can follow the ASHRAE guideline. Okay, that was most of the consultant what they are doing. Okay, based on at least that is a global recognized chapter, the ASHRAE that you can fulfill. So if you follow that, you will never go wrong. Okay, hopefully I answered that question correctly.
Yes. Okay. Thank you, Mr. Raymond. And the second one is oh no. Yep. There is no question again from her. And another question from Mr. Nurhadi Andi Andoyo. It's interesting that 1 millimeter gap at F9 filter would make it decrease like F8. So involving engineer is a must to prevent those decreasing quality. Can you give us a few advice to make sure that filters installed properly, or is there any technology can help it?
Okay, that is I would say that's a good question. Okay, you can see currently what we experience on site. See, these little gaps, okay, are being ignored. So through the site that we visit. Okay, good question of this. So each time when you replace the filter, make sure your size are correct. Okay, so when you install all the butt joint, that means the filter to filter, the gaps, make sure they are being closely. So when you close the what they call site access door, make sure that it has a little bit of compression, so that ensure the filter are being pushed, like not say push, okay, it's like squeezed, okay, slightly, so that this to ensure the even 1 mm gap is being eliminated, right? So if you close your access door and then the filter had no compression, that means imply that there is some gap. Okay, so the right way is maybe have to put some insulation on the access door. When you close it, you can sense that your filter have been compressed slightly. So that will be a good practice, I would say. Okay, the next thing is you need to understand of your what they call this, your filter holding frame style. Okay, get the right model and right types and the efficiency. Okay, that will be what they call a recommended way of approach when you want to do a replacement or a new system.
Okay, thank you.
Sure.
And from Mr. Muhammad Hazza bin Siror, do you sell carbon dioxide filter that can convert carbon dioxide to oxygen?
Okay, in general, I will rephrase the question that she's asking whether we do have able to supply gas phase filter. Yeah, we do have. We do have the dimension product. Yeah.
Yes. And from Mr. Leonardo Villar, what international products available at the international market would you recommend the best for air filtration system without affecting the good gas elements that we need in our body to function well in the office?
Wow, that is, I would say, a tough question to answer. As I shared in the earlier slide, okay, there's no strict guideline that we need to follow. Okay, in order to what they call this, to compliant to the requested condition, okay, first you need to do a what they call the IAQ analysis. What is present in your current situations? Then from the data that we capture, then from there we can take a correct select the right products to eliminate them one by one. Okay, but like say off the air or the layman, we are not able to do it because we don't have a bionic eyes what is present in the air in your office, right? So only through the air sampling test, then we're able to capture what is the unwanted what I call this, the contaminants. Then we need to work well on the contaminants to select the right products, okay, to clear it. Then we'll give you the air cleanliness that you want. Okay, that would be the more correct approach.
Well, getting interesting. And from, oops, sorry, there's telephone, right? From Ms. Elsha Asafira, what do you think on the effectiveness of portable air purifier, as many workplaces buy them to improve the air quality during pandemic?
Okay, this is also a good question because we also face that this kind of questions daily during our work. Okay, so it's a good question. Okay, what I would say is for any equipment, okay, before you buy, okay, so you need to know the area and what is the condition of your area and the concentrations present in your area. Then you select the right models that are able to cover the area and at the same time get rid of the contaminants levels. Okay, so in summary, if you select the right products with the right coverage, okay, is about 80% the efficiency you can remove. Okay, up to 80%. So to add on, the supplementary equipment, or we call it air purifier, okay, it alone it cannot do the wonder. So it will work well, like if you have your existing aircon systems. So this supplementary is just to add on, to add value to that existing system, which is the job that they cannot do. Okay. So,
yes.
Yep.
As you know that in Indonesia, there's a panic buying of our HEPA filter portable during the pandemic. So maybe the question is about that.
Yep.
And from Mr. Dedi Al Rasir, we call him Babe. How to maintain the static pressure when we make a replacement from filter MREV8 to MERV13? Thank you.
Okay. So you're asking how to maintain, right, the static of the filters, right? Okay, this is also another quick question. So at least you ask this question. Okay, this question will come if you need to do any upgrading, right? So every new products, sorry, not every products or air filtration products, they do come with two information on the resistance. One is the initial resistance. That means when they're brand new. Okay, what will be the resistance? And the second resistance is coming is a final resistance. So with these two resistance, okay, when you want to upgrade, you should analyze, know the products or the model they will select. What is the initial resistance? Then you have to go back to your existing system. What is the current system static? Okay, are they have been maximized or there are still gaps that you can allow to increase the static? You have to do this two evaluation, the basic evaluation first, before you go ahead with the purchase and then you replace it. Okay. So when you replace, in order to maintain the static, okay, you can do it differently. There's many ways and means to do it. Okay, the most common way is to install a pressure differential gauge. Okay, that means you got one port at the upstream, one port at the downstream. So with the pressure differentials, then you're able to tell you the what I call it, the current resistance that the filter is experiencing. Okay, whether it's already reached the final pressure drops. Okay, then that will give you a guide to do it. Okay, the second way is you use our one of the wireless systems. Okay, the sensor to help you to guide you instead of walking physically to the issue. You just use a mobile app where you have your breakfast. Okay, you tap the issue and they can tell you exactly what is the current status of that issue.
Thank you.
Okay.
And from Ms. Ganis Ramadhani again, one small question, just to inform that concerning to the indoor air quality, especially in the hospital, we have already have the rules and regulations issued by Minister of Health. I will focus to the oxygen supply in the buildings, which is we are fully depend on the air conditioning system. My question is, what is the long run impact, the effect of suffer or lack of oxygen for human health? Thank you.
I think this one is more to
doctor
question.
Dr. Stefani.
Okay, I assume from the air filtration side, right? Okay, I assume that like long run, if you're running the you're implementing or you're getting fresh air from the outdoor into the hospitals. So I assume he's asking the impact on the filtrations. Okay, so if you select the right filtrations, of course, the outdoor particles, of course, it depends on your air inlet where you take. Right? So you need to choose an air inlet that has least particle concentration to take. You don't choose a site or the inlet where you have near a construction site. So what happens if a construction site means your air filter choking rate will be very fast. So choose a place that is less polluted or less contaminated. That would be a long run. That means you have keep a very good economical way of spending the filters or replace the filters at the optimum points. So then in case you will not overspend, okay, to buying the filters. So hopefully that I understand, I mean, this question that is coming from there.
Yeah, no problem. Thank you. And from Mr. Rudy Susanto, hi Raymond, do you have a fan brand recommendation to be used for such clean room application?
Fresh brand, what is fresh?
I don't know. Fan. Maybe like
fan
yes.
Okay. For this question, okay, I would say it's really, we need more information now. Okay. What I call this, the type of fan, because it totally depends on the type of mechanical system that you are using. So of course, if you come into the air that is very corrosive, you should use a chemical resistant fan. Let's say if you just need a fan that you're using just a normal recirculation or to transport the air from A to B positions, okay, then you can use a energy saving, what we call a backward curve fans or something. But I'm not expert on that, so that it will be more advisable if you have your design, talk to your maybe your ASHRAE supplier or the ventilation supplier to give you the right fan model selections.
I think there is no. There is another question from Mr. Ahmad Alatas. How long is the fire resistance of the filters, and how much smoke does each meter square of filter produce?
Oh, that is a tough question. Okay, when you see okay, filters, we do have fire resistant. Yes, is right. Okay, so that filter, this filter, we call it they have UL compliance. UL means fire resistant compliance. Okay, it tested as per the UL what they call this, the standard regulations. So how long it can take is totally depends, okay, against on the site also, because when we tested sample test that is able to comply the UL guideline. Okay, but when you install on site, let's say if a nearby it have a chemicals storage, so that will have another story to tell. Okay, then the fire spreading is one thing because you have additional source, okay, to contribute to the fire, and the fire is too huge or too fierce. So the what they call this, the rate of burning may be faster.
Okay.
Okay.
We still have plenty time, but there is no question again. So I want to ask my question to you.
Sure.
Well, tell us more about the benefit of the new membrane EPTFE or FRM that you mentioned in your slides just now.
Okay, sure. This is a good question. Okay, this is a new available membrane media. Okay, that have the following features. Okay, so the advantage of having this is low initial resistance. Okay, as more not as much as up to 50% compared to the traditional glass. Right, so 50% less means you save 50% of energy. Okay, so if you have one piece, you save 50%. If you have 1,000 pieces, so there's a massive saving you have. Okay, and at the same time, the media itself is 84 times higher tensile strength. Okay, the tensile strength means you're able to use your finger to brush it. There's no impact on the media. For the traditional glass, you are not allowed to do that. Even just a fine little touch will puncture the media. Okay. So, and on top of that, it's almost at zero outgassing, okay, especially like borons, it's almost zero. Okay, where the traditional glass there is some emissions. Okay. With the zero, yep. There's more on like hydrophobic. Okay, so in case you accidentally spill some water, okay, it will no impact on the media itself. Traditional glass, you're not able to do that, okay, because that is made of paper. Okay. One more important is have great chemical resistance. Okay, how to tell the filter are experiencing the chemicals contact? When you look up from the clean rooms or you look up at the air discharge area, you can see it's turning yellow or turning something other color. That to telling you the filter are experiencing with chemicals. So for this new membrane, it will not have any impact. Okay.
Okay, thank you. Since there is no question again, I think that we will finish the session real fast, more than faster than we schedule on the schedule. So because Dr. Stephanie is not here anymore, so Mr. Raymond, could
Yep.
you give us a closing remarks to the audience
Sure.
before we end this session?
Yep, we are more happy to do that. Okay, we would like to say is a key takeaway for today is like, okay, air is essential for life. Okay, this is why we need to understand the underlying reason and the impacts of maintaining clean air through the industrial regulatory guideline, incorporating with the guideline guiding principles of bringing clean air to life, okay, making the air healthier for everyone, protecting people's equipments and our businesses. Okay.
Thank you, Mr. Raymond. So we have, well, audience, we have arrived at the end of the session. My task as moderator has been completed. And thank you very much for Mr. Raymond and also Dr. Stephanie to joining us with the best lecturer give to us. And I will give back the event to the host, Pak Ferdinand. Thank you for your participant or all audience. Assalamualaikum warahmatullahi wabarakatuh. Good.
Thank
Dr.
you.
Rini.
Thank you, Dr. Chayarini, Dr. Stephanie Taylor, and Mr. Raymond for a very fruitful, important, and also excitement presentation for us, not only for us as a professional, but also as a human being. A lot of information, a lot of very valuable information for all of us regarding the clean air quality. So thank you. So to all the participants, once again, on behalf of the ASHRAE Indonesia chapter, we want to invite you all and encourage you to join and become a member of ASHRAE Indonesia chapter, and we can all gain a lot of benefits, information. We can get a very, very good network, and also very valuable for our professional profile. So there's a link, there's a website, how to become a member in the chat box. And also please feel free to email us at any time if you need more information about ASHRAE Indonesia chapter. So all the participants, I think we already at the end of the webinar. First of all, we would like to thank you, Dr. Stephanie, who already taking her time during her busy and also in a very inappropriate time in this stage. Dr. Stephanie already leave now because I believe it's already midnight in the States. So thank you so much, Dr. Stephanie. And then we would like to thank American Air Filter Manufacturing, which represented by Mr. Raymond. Thank you so much, Mr. Raymond, for your kind support and become our sponsor in this webinar series. And we are looking forward for another collaboration and another corporation. And also we would like to thank ASHRAE Indonesia Chapter President, Pak Fatur, for the opening remarks and also a valuable information. And last but not least, we would like to thank you, Dr. Chayarini, for lead us the discussion as a moderator. Also in her busy time being a doctor. And please send our regards to the fellow doctor who are in front and also battle against the COVID-19. We really appreciate all of you to become the host and also the speaker for this webinar. And we are now at the end of the webinar. So thank you so much once again for all participants who are joined. And we hope to see you again. And also we hope we can meet you again in another webinar series. Thank you. Have a great day ahead and stay healthy. Goodbye.
Thank
Thank you,
you.
Pak Ferdinand. Thank you,
Terima kasih.
Raymond.
Thank
Thank
you.
you,
Terima
Pak
kasih.
Raymond.
Bye-bye.
Thank you.
Yeah, bye-bye.
Thank you, Mr. Raymond. Thank you, Mr. Tan, for your support.
Hey, you're most welcome.